So I'd just like to take 10 minutes today to give you a local perspective on organic growth in the industry. From someone who's actually on the ground working with entrepreneurs every single day. There's been a lot of high-level talk, and now I want to kind of get down to the nitty-gritty. What is actually happening, and what are these people facing on a day-to-day basis? Because I think you'll find there's a little bit of disparity. So I work as a consultant at Tech Alliance, which is a not-for-profit dedicated to assisting startup and early-stage technology companies, and I'm responsible for the health portfolio, which ranges from biotech, health IT, medical device, medical technology, a very broad base. One of my other roles in the community is actually sitting on a medical device subcommittee. And over the past few months, my colleagues and I at this table and others have been working on ways to grow the medical technology sector in London. And we've identified 5 keys to success from an organic growth perspective. I think you'll actually find, fortunately, after listening to all the great speakers these past 2 days, that many of these points have been coming up repeatedly in the discussion. So that's great to see that we're on the right track. I'm not going to touch on all of these, but I will highlight some of the key things that were brought up during the conference and how they apply to entrepreneurs and early-stage companies in our community. So entrepreneurial skills and training. There are a number of resources available to entrepreneurs in the city, and the more you look, the more you find. Just actually knowing everything that is available in the city is a full-time job in itself. And Tech Alliance and our regional alliance partners offer assistance to all startup companies and early-stage technology companies. Right from, I have an idea, what do I do with it, business plan development, market intelligence, investor pitches, legal, IP, regulatory, prototype, the whole gamut of the commercialization process. And using these resources, you can actually move ideas farther along than you might think along the commercialization pathway, which is important considering the lack of risk capital, which has been another theme of the conference. To throw in an old school G.I. Joe reference regarding access to capital, knowing really is half the battle. There's countless programs and resources out there, and a number of speakers have alluded to them. And really, if you try to print them all off, it would be 50 or 60 pages. And clearly, there is a lot out there. It's hard to navigate, but that's what people like me and others in our community are here to help you do. And I thought Sentinel Medical, who we heard from yesterday, was a prime example of a company that used blood, sweat, and tears to get their funding. And I'm, of course, referring to the graph that was shown identifying all of the different funding sources they used to get funded. And interestingly, it didn't involve angel groups or VCs. And I think that's an important point because that's not your only avenue. And it's certainly not something we suggest going after too early. So successful funding does require the full package, the idea, the team, and timing. And as I alluded to on my previous slide, we just need to get you far enough along the commercialization pathway to actually open up grant opportunities, engage larger investors, engage people like HTX, and those sorts of things. Having said that, skin in the game is a must, and I can't emphasize this enough. I deal with entrepreneurs every single day who just have an idea, and they come in the door and they tell me their idea and they say, I need to raise money because I have no money. And it's true, but I ask them, you know, do you have a house? Do you have savings accounts? Do you have RRSPs? Can you get a line of credit yourself? And, you know, oftentimes the answer is, well, no, I really don't want to take that kind of financial risk on the idea. So how on earth do you expect anyone else to take a financial risk on your business idea if you're not willing to take that risk yourself? I would never put these clients in front of larger investors unless they have a significant personal investment in the technology. Overall, I am more of an optimist on funding. I think great teams and great ideas are getting funded, and I'm seeing examples of this in our community. But the bar is very high, and you have to be creative. Incubators actually represent a wonderful and growing opportunity for very early stage companies. Unfortunately, most of these are either not health focused or they're abroad. And you know, I do work with clients right now who are receiving offers, health-based technologies, to go to California, to go to China. They're being offered $100,000 just to develop their ID in exchange for 10, 20% of their IP and their equity. And you know, we're not competing with that right now, and I would urge everyone to push for more incubators and more very early stage seed capital, because I think there's almost a mini bubble happening, but it doesn't seem like that our community is part of that. Finally, I just want to discuss market access. This is something that's come up time and again in the conference and I think is very important in our community as well. I'd actually argue this is the most important challenge to organic growth in this industry, in the city and Canada as a whole, because you can go through all of these hoops, the regulatory hoops, the prototype and everything, but if you can't get it into the market, it was a big waste, and we've heard this time and again at this conference. And so this, so if the goal is to have local companies with global ambitions, you need local market access, as this is a key inflection point for a company. If you create a favorable environment for R&D, you motivate them to stay local for the long term as they develop key relationships, and this could become the source of a competitive advantage with which to expand globally. Market access is no easy task, and just having a better mousetrap is not enough. There are confounding factors in healthcare. This is my last point. I'm going to make a little aside on it, though, because I do think it's very important. I'm going to use an example from the primary healthcare setting. A lot of talk over this conference has been about acute care. Medical technology has a huge role in primary care as well. My previous life before consulting was spent in health IT, and I work very closely with family physicians on EMR adoption and implementation. So first, a surprising statistic for many people. Can anyone here in the audience guess what percentage of Ontario family physicians were using EMRs in 2007? Anyone? Very close, less than 25%, or less than 1 in 4. When I first learned that, I was shocked. I thought it would be like 75 or 80%. And I'll add, this is in spite of funding and incentives that have been around for years to encourage EMR adoption into family practices. And this is something that the keynote speaker, Dr. Trachtenberg, was alluding to last night. But the more I learned and the more I worked with physicians and nurses in primary care settings, the more I realized why this is actually the case. Put yourself in a family doctor's office in London. Tuesday afternoon, waiting room's full, it's hot, noisy, appointments are running an hour behind. People around you are sick and fed up and starting to complain. A lot like this audience right now, probably, who'd like to go home. Now put yourself behind the desk of that office as the physician, as the health administrator, as the nurse. Okay, so you're in their shoes. You're one of the frontline healthcare workers. Imagine what it's like to convince these people, you know, I have this great new medical technology. It's going to revolutionize the way you care for your patients. It's going to make you faster, more efficient, more accurate, more easily integrated with the healthcare system in Canada, and will improve patient care overall. That sounds great, right? And they say, yeah, that's great, but what's the catch? And the catch is there's a small learning curve associated with the new technology. It'll probably take 12 to 18 months to fully implement the EMR and to fully realize the potential. It'll probably be frustrating, and you'll make a few mistakes, and things are probably going to get worse before they get better. That's where you lose them, because they deal with the front half of the office on a daily basis. Oh, and by the way, they're also paid by the number of people they see, so if you slow down the practice, they're not really going to want to do that. EMRs, as with many medical technologies, and I really think you can apply this outside of EMRs, even though I'm using that as an example, they're being sold into environments that are extremely change resistant because many of these involve a disruption to service and a steep learning curve. Healthcare providers are just too busy, and our system is under too much pressure to benefit from the long-term cost savings and efficiency of new technologies. We aren't in a position to be patient. So how do we get around this? I want to end on a positive note because it's not all doom and gloom. I'd argue it's a three-pronged approach. Number one, conventional methods of training, support, making transitions seamless, incentivizing doctors, and selling long-term benefits. These are working to some extent, although I'd argue not quickly enough. Physician engagement in development and improvement of medical technologies is paramount, and again, this has come up a lot during this conference. We have heard, this also applies in primary healthcare, although most of the examples have been for acute care, and there's a reason why some of the most efficient and successful family physicians in our community in London are using homegrown EMR solutions, because they've actually been a part of building these systems from the bottom up and not just implementing them once they're already developed. The final solution is something I think will actually happen over time without us changing anything, and is related to one of the first questions someone asked at this conference. There's a gentleman who stood up and asked, what do you think the revolution is that is going to have to take place in the industry moving forward? Are there any signs of what that might be? I was thinking about that a lot last night, and I was up at 3 a.m. changing my 6-week-old daughter. I still hadn't been to bed, and I had an epiphany. It may have been a hallucination. I'll leave it up to you to decide. But I'd argue that this revolution is kind of twofold. It involves, number one, shifting demographics, and I'm not referring to an aging population as a whole, but aging healthcare practitioners moving out of the workforce. As these doctors and nurses retire, we're ushering a new demographic of tech-savvy healthcare practitioners who can adopt and embrace new technologies quickly and easily because they grew up with them. It's not just age. Moving from paper to EMRs is way different than moving to like a new and better scalpel or something. There's just a huge switching cost if you have 30 years of paper data in your office and you're asking a doctor who's 3 or 5 years from retirement to switch to an EMR. It's just simply not feasible in terms of the switching costs. However, sorry, I got ahead of myself there. So we see in the statistics as well, although EMR adoption is low, it's much higher among younger physicians. This really is the revolution in my mind and was alluded to in the keynote yesterday. It's the move from the patient as the center to the actual health information as the center of care. And it isn't going to happen until we're all on an EMR and we're all on health systems. And I apologize to stress the primary care, but I really think this is the revolution that will happen. And I'd love to be a part of it happening in our community, and I think it needs to happen in all communities across Canada. So I'm quite optimistic about the future of medical technology for this reason. Thank you.